I have a question about the infrared laser. How does that work and what does, what is it good for?
Sure. So red light laser, how does it work and what is it good for? Um, I'd refer you back to my channel because we've covered this multiple times on the channel for specific issues like neurodegenerative issues, and then in general, just what is red light laser good for. But a quick synopsis is um, red light laser is known by multiple names. First of all, there's red light laser. There's low level laser therapy. There's cold laser. These are all different names for the same thing. And essentially, I've shown in previous videos that laser, whatever color it is, or if you can't see it, it's working on the light spectrum. So, from infrared to the visual spectrum to ultraviolet, depending on the color of the laser. So near infrared laser is NIR, and this is a wavelength you can't see because we can't see the infrared spectrum, but near infrared laser uh, is for having a deeper impact. And so this is beyond like a centimeter to an inch deep, whereas red light laser you can see, because that's obviously the red light spectrum, that's a more superficial impact. So whereas near infrared laser is 1 centimeter plus depth, red light laser is superficial, which I don't have my pen today, so I won't try and spell that out, but that is 1 centimeter and less deep. So from skin level to 1 centimeter depth, roughly. And then, there's different color lasers. If you see a green one or a blue one or a purple one, those are different wavelengths. And so each wavelength has different impact on the body, and different tissues have different wavelengths. And then ultraviolet would be, you know, you couldn't see that one either, and that's up that end of the spectrum. So how do they work? Well, the red light and the near infrared light, there's piles of research on these as anti-inflammatories, as increasing oxygenation. So they put out fires, they increase oxygenation of tissues, and all of our tissues require oxygen to function, right? Our mitochondria can take oxygen and produce ATP energy out of it. And so when you have more oxygen, you have more ATP energy and healing requires energy so you can heal faster with better oxygenated tissues and with less inflammation. Uh, they also increase blood flow. And so again, that's one way that you can increase oxygenation because the oxygen is carried by the blood. So increasing blood flow to tissue gets more oxygen, more nutrients to the tissues that are trying to heal, as well as can carry inflammation away from the tissue. And increasing the blood flow is done by vasodilating, so widening your blood vessels. So these are the three most well-researched impacts that the lasers have. But again, if you're getting tissue specific, I'm sure the women on the call have seen multiple blogs and little videos or whatever marketing content about using, red light laser for the face or for the skin. But it's great for whatever you're trying to work with, whether that's clearer skin or joint pain or gut function, just or neurological disorders.
Thank
And the
you.
cool,
I'll look it up on your YouTube and do a little more research.
yeah, good. And
Thank you.
there's essentially no negative side effect to it. You don't want to blast your eyes with it, but other than, that, it's safe and effective. There's utility from in-office lasers to in-office laser beds. They look like giant tanning beds, but it's actually thousands of red light and infrared light diodes that bathe you, as if you were in a tanning bed. So the real the real difference between devices is the power and how many joules of energy you're putting in over a certain amount of time. If you had a red light pointer pen, theoretically you could treat yourself with that. You just have to hold it on the spot for the rest of your life. Whereas, the red light laser tanning bed can put a ton of joules in you in 15 minutes or less. So the power and the dosage matter in terms of how quickly you're recovering from what you're seeking to recover from.